As healthcare fraud investigations ramp up across the country, Medicaid spending has come into focus, and a review of state agency payments has uncovered serious problems and red flags. The state of Pennsylvania, for example, had payments surge from roughly $5.5 million to nearly $600 million in just 7 years. Joining us with their own investigation of this is Deputy Public Policy Editor for OpenTheBooks.com, Rachel O'Brien. Good morning to you, Rachel. What I just pointed out is one example with Pennsylvania. How much Medicaid spending is there nationally for personal care services, and how did Pennsylvania's numbers compare with this?
Yeah, good morning, Jan. So we're talking about home and community-based care services. This is an alternative to residential nursing homes. So elderly or disabled people can stay in their homes, and in some states, they can hire their friends or relatives to care for them using taxpayer dollars from Medicaid. So nationally, we saw these figures between 2018 and 2024. Medicaid grew by 144%. So from $9.6 billion to almost $24 billion. But as you mentioned, these payments absolutely exploded in Pennsylvania by more than 10,000% in that time. And so it just shows that these Medicaid funded payments to Pennsylvania, they shot up, like you said, $5.5 million to $583 million. That comes from the Centers for Medicare and Medicaid Services, this data they released. That's
a lot, and certainly a red flag, which is why it's now being, brought to everyone's attention, and there's now an investigation underway. But what other states have an unusually large tab in Medicaid spending? Because it's not about the largest populations, which is why this is even more alarming, right?
Right. Yeah. So at Open the Books, we went through the figures, and, New York, talking about the home and community-based care services, New York is one of those states that allows you to hire friends and relatives to care for you using these taxpayer dollars. And so while Pennsylvania shot up as a percentage, that 10,000% in raw dollars, New York State has spent the most of any state, $73 billion, between 2018 and 2024. And that accounts for about half of all of New York's Medicaid spending. If you're looking at all Medicaid programs, all spending, not just the personal care services, of course, New York, California, and Texas, they've spent the most. They're very large populations. But as you mentioned, you have Massachusetts and New Jersey are nowhere near the largest states. They've got 7 million and 9.5 million people, respectively. They have higher spending than states like Florida and Pennsylvania with larger populations. So the size of the population doesn't always correspond with how much money they're spending. Yeah. And so, we did look. So, for instance, there were 11 businesses we found that were paid over $1 billion each for these personal care services. 9 are in New York, but 2 are in Massachusetts.
Did you say 1 billion? With a B?
1 billion. That's correct.
Wow. And your organization always goes to the top for answers. Have you heard back from Pennsylvania Governor Josh Shapiro, anyone from his office, or any state officials in Pennsylvania about this?
No, we did reach out. We asked for a comment. They didn't respond. We also reached out to the Pennsylvania State Health Agency. They're the ones that administer this program. They oversaw that 10,000% spike in payments. They didn't respond either. So obviously they should give answers as to why this happened and how they'll root out fraud. We don't know how much of this is fraud. Obviously, if it's shooting up by 10,000%, there's got to be some fraud in there, right?
You would think.
You would think. So the CMS administrator, Mehmet Oz, he should be interested in this explosion of funding, not only because it comes from his agency, CMS, right? It's happening in the state that he claimed as his home. He ran for Senate in 2022. So we commend the release of this Medicaid data set. They did release this, the government, voluntarily. This is great information. Taxpayers can see the real dollars that are spent, how policies have increased the cost of the Medicaid program. And we hope the Trump administration continues releasing data for more years and for more programs so we can continue going through it.
And we hope you guys continue as well so we can all see it. In the name of transparency, OpenTheBooks.com's Deputy Public Policy Editor, Rachel O'Brien. Thank you for joining us this morning. Have a good one.
Thank you, Jan.
We're following some developing news out of the Middle East right now. Pakistan is declaring open war on Afghanistan.